When you picture it this way, the difference between the groups becomes very clear. For the low-risk group, recurrence is possible, but progression is almost never an issue. For the intermediate group, recurrence is common, but progression is still rare. For the high-risk group, both recurrence and progression become a significant worry. And for the very high-risk group, almost half of patients will face progression within 5 years, which is why doctors often recommend considering early bladder removal in people who are fit enough for surgery. It is also important to remember that these numbers come from patients who did not receive any additional treatment. In real life, patients usually get intravesical therapy, most commonly BCG. Studies have shown that BCG lowers the chance of the cancer coming back by about 40% and reduces the risk of progression by about 27%. This means the actual risks for patients who receive treatment are lower than the raw figures suggest, though they never completely disappear. So, if you imagine being one of those 100 patients in the room, where you fit in the story depends on the type of tumor you have. Some people face only a small chance of serious trouble, while others face much higher risks. Knowing which group you belong to allows you and your doctor to make decisions together, whether to continue with bladder-preserving treatments and close monitoring, or to go for the more radical step of bladder removal to reduce the risk of facing a more dangerous cancer in the future.